Good day everyone. So today we are going to discuss about the different diseases in the respiratory system, and we're also going to tackle about their symptoms and their treatments. Okay, so let us begin with the chronic bronchitis. So what is a chronic bronchitis? Bronchitis is an inflammation of the breathing tubes. These are the airways called the bronchi. This inflammation causes too much mucus production and other changes. There are different types of bronchitis, but the most common are the acute and the chronic. Chronic bronchitis is a long-term inflammation of the bronchi. It is common among smokers. People with chronic bronchitis tend to get lung infections more easily. They also have episodes of acute bronchitis when symptoms are worse. To be classified as chronic bronchitis, you must have a cough and mucus most days for at least 3 months a year for 2 years in a row. Other causes of symptoms such as tuberculosis or other lung diseases must be ruled out. People with chronic bronchitis have chronic obstruction pulmonary disease or the COPD. This is a large group of lung diseases that includes chronic bronchitis. These diseases can block airflow to the lungs and cause breathing problems. The two most common conditions of COPD are the chronic bronchitis and the emphysema. So later on we will also discuss the emphysema. But for now, let us focus with the chronic bronchitis first. Okay, so what causes chronic bronchitis? Chronic bronchitis is not caused by a virus or bacteria. Most experts agree that the main cause of chronic bronchitis is cigarette smoking. Air pollution and your work environment may also play a role. This is especially true if you also smoke. Bronchitis symptoms often happen with other lung diseases such as the asthma, pulmonary emphysema, scarring of the lungs, or the pulmonary fibrosis, the sinusitis, tuberculosis, upper respiratory infections. Okay, so yun. And what are the symptoms of chronic bronchitis? Okay, so here are the most common symptoms of chronic bronchitis. But each person may have slightly different symptoms, and those symptoms may include cough, often called the smoker's cough, coughing up mucus or the expectoration, wheezing, chest discomfort. People with chronic bronchitis often have a cough and make mucus for many years before they have shortness of breath. Chronic bronchitis may cause disability, frequent and severe infections that affect your airways, narrowing and plugging of your breathing tubes or the bronchi, and trouble breathing. Trouble breathing. Other symptoms may also include bluish fingernails, lips, and skin because of lower oxygen levels, wheezing and crackling sounds with breathing, swollen feet, and also a heart failure. Okay, so let us now proceed to the treatment of chronic bronchitis. How is chronic bronchitis treated? Treatment for chronic bronchitis is aimed at treating the causes and symptoms. It may include quitting smoking, staying away from secondhand smoke and other lung irritants, since it is mentioned later no, that one of the causes of the chronic bronchitis actually talaga is the smoking. So, in order to prevent having the chronic bronchitis, one of the treatment of it is to quit smoking or stay away from any secondhand smoke. It also includes taking medicines by mouth or oral to open airways and help clear away mucus. Taking inhaled medicines such as bronchodilators and steroids. Getting oxygen from portable containers may also do. Having lung reduction surgery to take out damaged areas of the lung. You can also get a lung transplant in rare cases of chronic bronchitis. humidifying the air, and also the pulmonary rehab to help you learn how to live with your breathing problems and stay active. Okay, so next is the pulmonary fibrosis. Pulmonary fibrosis is a lung disease that occurs when lung tissue becomes damaged and scarred. This thickened, stiff tissue makes it more difficult for your lungs to work properly. As pulmonary fibrosis worsens, you become progressively more short of breath. The scarring associated with pulmonary fibrosis can be caused by a multitude of factors. But in most cases, doctors can pinpoint what's causing the problem. When a cause can't be found, the condition is termed idiopathic pulmonary fibrosis. The lung damage caused by pulmonary fibrosis can't be repaired, but medications and therapies can sometimes help ease symptoms and improve quality of life. For some people, a lung transplant might be appropriate. Okay, so let us now proceed to the symptoms of pulmonary fibrosis. Okay, so here are the signs and symptoms of pulmonary fibrosis. The first one is the shortness of breath or dyspnea, a dry cough, fatigue, unexplained weight loss, aching muscles and joints, widening and rounding of the tips of the fingers or toes, or what we call declubbing. Now, how is pulmonary fibrosis treated? Most pulmonary fibrosis treatment focus on easing symptoms and improving your quality of life. Your provider may recommend one or more treatments. This includes the two types of medications, the pirfenidone and nintedanib. It may slow down. It actually may slow down your lung scarring, and these medications can help preserve lung function. The next one is the oxygen therapy. Giving your body extra oxygen helps you breathe more easily. It may also increase your energy and strength. The third one is the pulmonary rehabilitation. Staying active in this special exercise program may improve how much or how easily you can do everyday tasks or activities. Next is the lung transplant. A lung transplant replaces one or both diseased lungs with a healthy lungs or lung from a donor. It offers the potential to improve your health and quality of life. A lung transplant is major surgery and not everyone is a candidate. Ask your provider if you may be eligible for a lung transplant. Okay, so can pulmonary fibrosis be cured? Unfortunately, there is no cure for pulmonary fibrosis that exists today, but researchers around the world are working to change that.